You're rinsing breakfast bowls when a headline flashes across the radio, measles cases are rising again, and everyone seems to be arguing about vitamins. Maybe you've seen the posts, a spoonful of vitamin A here, a warning about vaccines there, all squeezed into confident little squares. Today's story isn't about choosing sides. It's about separating two questions that got tangled together: what prevents measles and what supports care after infection. In April 2025, CDC reported 800 U.S. measles cases since January, with 85 hospitalizations and 3 deaths already recorded that year. That number mattered because the United States had declared endemic measles eliminated in 2000, not gone forever, but no longer constantly circulating. In that same CDC update, 96% of patients were unvaccinated or had unknown vaccination status, a pattern public health teams watch closely. And into that anxiety came vitamin A, not as a quiet clinical detail, but as a social media argument with sharper edges than the science itself. CDC describes measles as among the most contagious infections. Up to 9 out of 10 susceptible close contacts may become infected after exposure. That's why measles changes the math. With some viruses, distance and timing help. With measles, the room itself can become part of the exposure. CDC says measles can remain infectious in air or on surfaces for up to 2 hours after an infected person leaves. So prevention has to happen before the cloud arrives. That's where the MMR vaccine stays central, even when supplements dominate the conversation. Pause. CDC's clinician guidance states plainly, vitamin A does not prevent measles and is not a substitute for vaccination. That sentence is the hinge of the whole episode. Vitamin A can belong in measles care, but not in the prevention slot. CDC notes measles often begins with high fever, cough, runny nose, and red, watery eyes before the rash appears. By the time a rash makes the picture obvious, exposure may have already moved through siblings, classmates, cousins, or passengers sharing stale indoor air. People with measles can spread it from 4 days before through 4 days after the rash appears, according to CDC clinical guidance. If measles exposure is possible, consider calling ahead before showing up anywhere crowded. That one step may help protect infants and immunocompromised neighbors. Now let's follow the confusion. Vitamin A is real biology. Your immune system and the lining of your eyes and airways use it. CDC says there is no FDA-approved antiviral therapy specifically for measles. Care is generally supportive while complications require professional management. Supportive care means helping the body through illness, fluids, fever guidance, watching breathing, and getting medical help if complications start to appear. CDC guidance allows vitamin A for infants and children with measles under healthcare provider supervision, using age-specific dosing rather than casual guessing. That distinction matters. One approach is supervised treatment after illness is identified. Another is self-dosing before exposure. The evidence supports them very differently. CDC warns that overuse of vitamin A can lead to toxicity affecting the liver, bones, central nervous system, and skin. More is not automatically better. Fat-soluble vitamins, including vitamin A, can build up in the body when intake gets too high. CDC also cautions pregnant women to avoid high vitamin A levels because excessive intake can increase birth defect risk. So if you're pregnant, trying to become pregnant, or managing liver disease, high-dose supplements are a conversation for a clinician, not a comment thread. Here's the practical frame. Food sources of vitamin A fit into normal nutrition. High-dose capsules during an outbreak are a different decision. The 2025 CDC report linked the resurgence to outbreaks, many in close-knit communities with lower vaccination coverage and more susceptible people. Outbreaks don't spread through averages. They spread through pockets: a church gathering, a school hallway, a shared van, a family reunion. CDC reported that 11% of U.S. measles patients in that early 2025 period were hospitalized. That's the part easy online debates miss. Measles isn't just a rash. It can lead to pneumonia, dehydration, ear infections, and serious complications. CDC specifically says measles complications such as pneumonia should be managed by healthcare professionals because supportive care must match the patient's condition. If a child has fever, cough, red eyes, and possible measles exposure, consider calling your pediatrician or local health department before entering a waiting room. CDC advises healthcare providers to isolate suspected measles cases quickly because airborne spread can expose others before diagnosis is confirmed. Notice the pattern. The public health response is about timing, identify exposure early, reduce spread, and protect people who can't yet be vaccinated. CDC states that MMR vaccination remains the best way to protect against measles and its complications. If you're unsure about your MMR status, consider checking immunization records, especially before international travel or visiting an outbreak area. For certain exposed people, CDC notes MMR within 72 hours or immunoglobulin within 6 days may be considered after exposure. That is prevention after exposure, not vitamin A prevention. Different tool, different window, different reason to act fast. So why did vitamin A become so loud? Because it contains one true piece, and true pieces can be misleading when they're placed wrong. CDC's measles guidance says vitamin A may be part of treatment for infants and children with measles, under provider's supervision. If measles is diagnosed, ask the clinician whether vitamin A applies, what dose fits the child's age, and how to avoid repeat dosing mistakes. This is where humility helps. A supplement can be useful in one narrow lane and still be risky when driven everywhere else. CDC's warning on vitamin A overuse includes possible effects on skin, bones, the liver, and the central nervous system. If an influencer recommends high-dose vitamin A for everyone during an outbreak, consider treating that as a reason to slow down. A better move. Save the post, don't share it yet, and compare it with CDC guidance or a clinician who knows your health history. CDC's 2025 MMWR found 96% of reported measles cases were in people unvaccinated or with unknown vaccinated status. That does not mean every vaccinated person is invincible. It means vaccination shifts the odds dramatically at the population level. Health choices usually work like layers: vaccination, exposure planning, calling ahead, and clinician-guided care each add protection in their own lane. CDC says measles is spread by breathing contaminated air or touching infected surfaces than touching the eyes, nose, or mouth. That airborne part is why hand washing alone, while worthwhile, cannot carry the whole burden when measles enters a shared indoor space. CDC reports measles rash typically appears 3 to 5 days after early symptoms begin, after fever and respiratory signs. If symptoms fit, and exposure is plausible, one approach is to stay home, mask if instructed, and phone for next steps before travel. For parents, the hardest part may be uncertainty. A fever could be ordinary. A rash could be many things. Exposure history becomes crucial. CDC asks providers to stay alert for measles in patients with febrile rash illness and compatible symptoms, especially with travel or exposure. Before travel, consider checking every family member's MMR status. If records are missing, your clinician or health department can help decide next steps. And if you love nutrition, keep loving nutrition. Carrots, leafy greens, eggs, and orange vegetables support health without pretending to replace immunization. CDC's clinical overview separates measles prevention from treatment, placing vaccination in prevention and vitamin A in supervised care after illness. That's the sentence to keep: prevention before exposure, supportive treatment after infection, and professional guidance when doses could harm. The internet loves a single answer. Biology usually gives us a map with different roads for different moments. CDC's April 2025 report called the case count the second highest annual total in 25 years, even though the year was not over. Size. That is sobering, especially because measles was once considered eliminated here. Resurgence does not happen randomly. Susceptibility accumulates quietly. If you're worried, consider making a simple plan: records checked, travel risk reviewed, pediatrician number saved, and no high-dose supplements without guidance. CDC says suspected measles cases should be reported promptly to local health departments, helping teams identify contacts and reduce further spread. Public health can sound abstract until you picture the newborn in the grocery line or the neighbor receiving immune-suppressing medication. Your choices may help create safer air for people whose immune systems cannot respond the way yours can. CDC's bottom line remains consistent. MMR vaccination is the main protective tool. Vitamin A is not a substitute for it. This content is for informational purposes only and is not a substitute for professional medical advice. Always consult your doctor or a qualified healthcare provider before making changes to your health routine. For this week, consider one small step. Confirm your MMR record, especially if you travel, work with children, or live near an outbreak. If this helped untangle a noisy health story, a like or subscribe quietly supports more evidence-based episodes like this one. The goal isn't fear, it's proportion. Measles deserves respect. Supplements deserve context. Vaccination deserves its place in prevention. When the next confident post appears, you can pause and ask, is this about preventing infection or supporting care after diagnosis? That question alone can turn confusion into clearer, calmer decisions for you, your family, and the people breathing the same air.